guys, it's Izzy and welcome back. We are in a slightly different area. I mean, very slightly, but I figured we would be in a slightly different location because we are doing a bit of a different video today. I am chronically ill and disabled, and I have a lot of things wrong with me. And even I struggle to keep up with how many things are wrong with me. I figured this would be a good way to raise awareness of a lot of different illnesses you can have. Like, I think for most people it's like cancer is like the idea of illness, and there are so many other forms of illness, and especially chronic illness, that just don't get talked about, and I have many of them that don't get talked about. So I figured I would talk about them and kind of explain them in a way that's accessible for people and not too medicalized. And I also figured this would be a good resource if you have any of these conditions and want to send this to a family member who maybe is struggling to understand exactly what is happening with you. And I will be putting up pictures throughout this video to illustrate my points and just show you some of the symptoms, etc. So yeah, let's get started. I will be looking down a little bit because I've got all my notes on my laptop, so if you think I'm just like looking at my lap, I'm not, I'm just looking at my laptop. So yeah, let's get started. So I have an overall condition. I have a connective tissue disorder. I'm currently diagnosed with Ehlers-Danlos syndrome type 3, which is the hypermobility type, but I am under the 100k Genome Project, which is a project for people with conditions that aren't officially diagnosed, conditions that they haven't really recognised yet. And so they basically take my DNA and they sequence my entire DNA, looking for mutations in my genes to see if they can pin down exactly which mutation has caused my body to be like this. But my current diagnosis is EDS type 3 because so far that's the closest diagnosis we have for me. So that is what I say to people, is I have Ehlers-Danlos syndrome. But basically a connective tissue disorder is quite a big deal because connective tissue makes up a large majority of the body. It is in, I'm going to look down for this because it's a long list, it is in organs, tendons, ligaments, arteries, skin, cartilage. It lines your organs, it's in your bones, it's in your immune system and in your blood. So if you've got faulty connective tissue, then you're gonna have some problems because it's everywhere. Most of your body is made up of connective tissue, and it doesn't mean I don't have connective tissue, because obviously I wouldn't be alive, but I have like defective connective tissue that doesn't do its job in most of the places it should be doing its job. This has always been a part of me. It's in my genetics. So when I was born and when I was younger, I had to have splints to learn how to walk because my feet would just like turn around and I was just too like hypermobile. Everything was just too wobbly and I couldn't walk and I couldn't like hold my head up and things like that. I struggled in primary school because I was just so much more tired and I found walking so much more painful than everyone else. But then when aged 11 I started to go really downhill because it starts to get a lot worse when puberty hits, unfortunately. And so since 11 I've been pretty debilitated by these conditions, and yeah, so it's been with me all my life, but it's been worse since age 11 and I'm 20 now. So I've separated this, oh my goodness, it's suddenly gone really dark, I apologise. England's weather, so fun. But I have separated this into categories and I've like separated it into the sections of my body to make this like easier to understand. So we're going to start off first with joints, and that's fun. So starting off with my knees, I have knee impingement. So basically what that means is there's a fat pad in your knee that basically, so when you like kneel down and when you like bend your knee and stuff, there's a fat pad so that your bones don't rub together. So there's a fat pad there to protect your bones and to make it easier for your knee to move basically. And knee impingement is when that fat pad is kind of stuck between two bones or gets like caught in between something. So it's an extremely painful condition and it makes it very difficult for me to move my knees, like sit up, stand down, stand up, sit down, etc. I also have hyperextension, so my knees go back too far. So like if this is your leg, my leg is like kind of like this, where my knees go like backwards. I'll put a picture up to explain. So I have to wear braces for that because it's not good for your legs to constantly be going too far past the point that they should be. The symptoms I get from both of these are extreme pain, swelling of the joints, like really bad swelling, burning from the like wear and tear that my knees go through, and yeah, mainly pain. I also get subluxations in my knees. I get subluxations pretty much everywhere, and what subluxations are partial dislocations. So obviously when you dislocate your joint completely like one of your bones completely pops out of your joint, whereas with subluxations it like partially comes out of the joint, so it's not a full dislocation but it does move around a lot, which causes a lot of wear and tear to the joints, and it can be painful, but it's just annoying because you have to keep putting your joints back into place, which is a full-time job for me. I get subluxations in my ankles, in my knees, in my elbows, in my wrists, in my shoulders, basically everywhere that your body moves I get subluxations. I do also get dislocations, but they happen less for me. My main joint that dislocates are my shoulders, and we will be moving on to shoulders now. In my shoulders I have wing scapulars, which means the shoulder blades protrudes from my back, so you can very clearly see the shoulder blades. They look kind of like weird deformed wings. Again, I will put up pictures. And I also suffer from dislocations quite severely in my shoulders, and they are just very dodgy and they are very movable, so they don't have a lot of strength because they just move around too much and they're not held in properly, so they just move around a lot basically. That means I have limited movement, dislocations and very severe nerve burning pain in my shoulders. From the wing scapulars, that means I can only raise my arms this high. I can't raise them any higher because my anatomy just doesn't allow it. So yeah, my arms only go up this far. I can't raise them higher. So I mean, I'm tall, but I can't actually reach anything because I can't move my arms up high enough. So that's annoying. Okay, that's us done for the joint section. We will now be moving on to the heart / the autonomic system. Now, your autonomic system is basically what is in charge of all the things you do subconsciously, so things like breathing, your heart beating, sweating, digestion, all that kind of stuff that you obviously don't think about doing. You don't like make your heart beat, it just does it by itself. So your autonomic system covers a very large part of your body because obviously there are a lot of things you do subconsciously, and basically I have something called postural orthostatic tachycardia syndrome, which is shortened to POTS because who wants to say that every time? And it means basically your autonomic system has kind of gone haywire. Basically it's kind of gone wrong. Like it's still there and it still does jobs, it just doesn't do them efficiently or the way that it should. My symptoms are tachycardia, which basically means a fast heart rate. Before I started taking medication for my heart rate, my resting heart rate was 120 beats per minute, and my basically when you sit up or stand up, your heart rate increases because you are moving, and my heart rate would go up to at least 160. So as soon as I stood up, like my change in heart rate would be at least 40 beats per minute, and that made me very breathless. It made it very difficult and tiring to do anything because my heart was just beating way too fast. For someone my age, your average resting heart rate should be between 60 and 100, but it usually sits around about 80. So my resting heart rate being at 120 and then going up to 160 was very unhelpful and quite dangerous for my body, because your heart just shouldn't be beating that fast. So I take medication now which helps to slow it down. It also means I have a lot of blood pressure issues. My blood pressure can be too high or it can drop really low, which means I can pass out and faint. It also means I can't actually sweat. I have no control over my temperature, because the purpose of sweating is to cool your body down, and because my body just doesn't sweat, I can't like cool myself down or regulate my temperature properly, because my body just decided that it shouldn't sweat, because my autonomic system is just kind of broken, so I can't sweat. I also have severe blood pooling. I'll put a picture up here. There'll be pictures throughout this whole thing, so I don't need to keep mentioning that. But basically the veins and muscles in my legs are the veins are loose and the muscles aren't strong enough. So obviously blood pumps around your whole body, but my blood sort of drops to my feet and my legs can't push it back up to my heart, because the veins aren't strong enough to pump it back up. So I have a lot of blood pooling into my legs and ankles and feet, so I wear compression stockings, which helps the legs to pump the blood back up, because otherwise I just get really faint and dizzy, and because I'm not getting enough blood back up my body. I also get palpitations, which is like where your heart feels like it like skips a beat, and I also get like blacking out and very, very severe dizziness, which is helped by medication, but it's still quite debilitating. Also in my heart I have an aortic dilation. So basically in your heart you have different chambers. You have an aorta and I haven't been to school in a while, so but you know, you have those things that bring the blood and oxygen into your heart and take the blood out of your heart. And basically one of my aortas is stretched and is looser than it should be, and that has to be closely monitored, because if it gets too dilated it can cause an aneurysm because the blood isn't moving properly. But currently it's not at the stage where it would require surgery, but it has to be monitored every year to make sure that it's not growing in dilation. But I have to be under a special hospital for that, because it's not that common, especially in people my age. It's usually in elderly people. So that's my heart and autonomic system. On to the next one. This is like, I feel like I need like a slideshow, because I don't know, we need to make this jazzier. The next thing I'm on to is my immune system. I have a condition called mast cell activation disorder, which is an immunological, it's such a hard word to say, an immunological disorder, which basically affects the cells that are in charge of allergic reactions. So when you have an allergic reaction, your body obviously is told that you're having an allergic reaction by these cells, and my cells are disordered in the fact that they just fire off randomly. So my body thinks it's having an allergic reaction even when it's not having an allergic reaction. My body just fires off what would happen if you were having an allergic reaction. So it's kind of hard to explain, it's kind of hard to understand, even doctors struggle to understand it, but basically my body just decides to give me an allergic reaction response. Things that can trigger this are stress, temperature changes, different like detergents. If we change like the detergents to wash my bed sheets, that can start it off. Food, sometimes my body just decides it's allergic to a food one day. Also perfumes, so if I'm like sitting next to someone with a lot of perfume on, that sets it off, so I can't be around people with very strong perfume. And also different fabrics and the sun is a big trigger for mine. I can't be directly in the sun, and basically the symptoms I get are like very big rashes all over my body and like hives, a lot of itching, a lot of flushing. You may have seen in my past videos that my cheeks are pretty much always red. They are just constantly red and flushed, and also it produces a lot of adrenaline in your body, because that's what happens when you have an actual allergic reaction. Extra adrenaline is produced, and because my body just thinks it's having an allergic reaction, I have extra adrenaline, which kind of makes you feel a bit like jumpy and a bit kind of like, it's like your fight or flight stimulator, so it makes you feel like a bit itchy and kind of like cruelly, like your body's kind of like on edge, so it's quite unpleasant. I will again put up a lot of pictures of some of my rashes. This is what happens pretty much every day in different places on my body, and some of them can last for like 10-15 minutes, some of them can last for hours, and I take a lot of medication for it. I also get headaches and again tachycardia. It makes my heart beat faster because again my body thinks it's having an allergic reaction. My other immune condition is mannose binding lectin deficiency. I basically don't have a protein in my blood which is mannose binding lectin. I don't know what that is, but it basically means that I'm much more susceptible to infections, especially upper respiratory ones like pneumonia and meningitis, and more serious ones, as well as a lot of bladder infections, because I just don't have a protein that helps to fight infection. And also once I get an infection, it's much harder to get rid of because again the protein isn't doing its job properly. So I'm very susceptible to illness, so I can't have anyone ill near me because I will catch it. The next section is spine. Yes, it gets its own section. Wow, lucky spine, woo. So basically, when I was 13, I developed scoliosis, which is a sideways bend in the spine. Again, here is an x-ray of what my spine looked like, and eventually scoliosis can progress and can compress your organs. So once it gets to a certain degree, they have to operate so that your organs don't get squished. And so at age 40, I was either 14 or 15, I'm 20 now, how long, yeah, it was 5 years ago, so I was 15, I had spinal fusion surgery. So basically they cut you open and they move your spine into a straight position, and they use screws and rods to fuse it together, and then they use like, I think it's bone marrow, so that your actual vertebrae, which are the little bones that make up your spine, will fuse together themselves. And yeah, so you just have one straight spine, so I can't bend or move, it's just like fused together, so I can't like bend over or yeah, move my spine. I have x-rays of what it looks like post-surgery. I couldn't be bothered to scan these in, so we're gonna have some, wow, physical. So this is what my spine looked like after the surgery. I have 26 screws and 2 rods in my spine. I was fused from T4 to L4, which means thoracic 4th vertebrae to lumbar 4th vertebrae, and that's a very big section of your spine, which is quite unusual because usually it's a smaller area, but mine took up most of my spine. So yeah, as you can see, I have screws and 2 rods in my spine, and here's a sideways view so you can see the screws going into my spine to hold it in place. So I had that 5 years ago, and then quite quickly after I developed something called proximal junctional kyphosis, which basically means above where my fusion ends there's 3 vertebrae above where my fusion ends and 3 vertebrae below where my fusion ends, and the 3 vertebrae above my fusion started to bend forwards, which is called kyphosis. So basically, instead of the vertebrae bending sideways, they bend over. I will put a picture of what my neck looks like. It kind of looks like a shelf. Could probably keep some stuff on there. That is monitored very closely because as it is a progressive thing, and they have to make sure that your spinal cord is not in danger and your nerves are not being compressed, because if your spinal cord is in any danger it can lead to paralysis. So it's closely monitored by my spinal team, and it causes a lot of pain because my muscles around my neck are constantly in spasm. They're just permanently in spasm because of the positioning of my head. So I get a lot of pain in my neck and shoulders, and also I get really severe tension headaches, and they can flare up. So for months on end I can't look at screens, I can't have my eyes open for a long time, I have to have my eyes shut for most of the day because the headaches are so severe, and that just basically flares up when my neck pain flares up. So it's quite a debilitating condition. I can't hold my head up by myself, so I have always got a chair, and yeah, it's quite a difficult condition because if I have to have surgery I will be fused up to my skull. So basically I won't be able to move my head at all. I will be fused from the bottom of my spine all the way up to my skull, so I will have no movement whatsoever. I currently have very limited movement in my neck because of the positioning. That's as far as I can turn my head, that's as far as I can look down, look up, that's as far as I can lean sideways, that's as far as I can lean sideways. So obviously it's very limited. I have to turn to look at people and stuff, so it can be very difficult to manage. I then have the 3 vertebrae below my fusion, and they have recently started to move and develop scoliosis, which has shifted my pelvis quite significantly. So my pelvis is in the wrong position and it's very uneven, so it's quite difficult to sit because one side is much more pelvis-y than the other side. I unfortunately don't have an x-ray of that, but basically my pelvis is shifted to one side. I also have spinal arthritis in the 3 vertebrae below my fusion because they are unfused, whereas the rest of my back is fused. All the pressure goes to those 3 vertebrae, so they have a lot of wear and tear and have developed arthritis due to that. I also have 2 Tarlov cysts on my spine, which are fluid-filled nerve root cysts. I'm going to see a neurosurgeon about this. They can be drained or they can be removed. We're not sure yet what the best treatment option for me is, but they can be quite difficult because they can affect things like your bladder and your bowel, and yeah, they can affect a lot of things. They can cause pain. I also have nerve entrapment, which means one of my nerves is compressed in my spine. So I suffer from sciatica, which is basically you have a sciatic nerve running from your pelvis all the way down your leg to your feet, and I have bouts of sciatica, which means I have very, very severe burning pain all the way down my leg and into my foot, and I have altered sensation, so my leg feels much heavier than it actually is, so I can't really walk during those times because my leg feels really heavy, so I kind of just have to drag it along with me, and I get bouts of that when the nerve is more irritated, and that makes walking very difficult. It's extremely painful, and I am bedbound when I have really severe bouts of that. The next section is my bladder. I don't really have any names for my bladder conditions. They're kind of just, I don't know why they're not called anything, but basically I have 0 sensation in my bladder, so I cannot feel my bladder at all. If you told me I didn't have a bladder there, I'd believe you, because I just can't feel it. So I have no sensation of needing to go to the toilet or anything like that, because I just have absolutely no sensation in it whatsoever. They think this may have happened during my spinal surgery because they went down quite so low. They think there may have been some nerve damage during that surgery. I also have really severe bladder spasms, so basically my bladder will like spasm and it's an extremely painful process, and it can last for a while, and the pain is really severe. I also have recurring urinary tract infections, which are infections in your bladder, and it's very difficult for me to consciously empty my bladder. The cause of these things are thought to be a combination of my connective tissue disorder and also the spinal surgery that I had. Moving on to my gut/bowel, I have bowel dysmotility. So basically what your bowel and your gut does is it like squeezes and it like moves the food like down your gut into your bowel, and basically my gut and bowel just doesn't do that. It doesn't do any of those movements, so it doesn't really function. I have basically zero transit, so basically nothing moves down properly, and I will eventually need stoma surgery because my bowel will not ever get better. They think again it was a cause of spinal surgery and my connective tissue disorder, because I have both muscle and nerve issues. So my nerve, I again can't feel my bowel, and my muscles don't do any of the pushing that it's supposed to do, and my nerves again don't do any of the jobs that they're supposed to do. I also have acid reflux, which is acid that comes up your esophagus into your throat, into your mouth. It's like bile, acidic stuff that comes up your esophagus and gives you very painful chest and throat and things like that. I also have a hypersensitive gut and esophagus due to the acid exposure from my acid reflux. Basically, having a hypersensitive gut and esophagus just means the symptoms that you have are more intense because your gut and esophagus are much more sensitive. I also have small intestinal bacterial overgrowth, SIBO. I have a lot of things that are shortened to weird what are they called, acronyms, is that what they're called? But basically that means because my gut is very stagnant and it doesn't move and it doesn't do the job it's supposed to do, I have severe bacterial overgrowth because the bacteria isn't being moved properly and isn't being processed. Basically it's just not going anywhere, it's just sitting in my small intestines, so not very helpful. My symptoms from that are extreme bloating, and I mean extreme. I will put up a photo, but I basically look like 6 months pregnant at least most of the time, pretty much any time I eat, but even when I don't eat I still am extremely bloated. I have very low appetite. This can fluctuate, but there are times where I can't really eat anything except like liquids and like mashed potato and like nutritional drinks and stuff like that. So I have also fluctuating weight because I have times where I can eat more and I have times where my bowel will stop and I can't really eat anything and have to be in hospital, etc. I get really bad stomach pain, like stabbing pain in my stomach because none of it's doing anything, and I have no sensation in my bowel and no natural bowel movement. Then we're on to eyes. I have blepharitis in my eyes, which is basically granulation around your eyelids, which makes them very sore, itchy and irritated. I have a blocked tear duct, which meant my eyes used to weep constantly, like they were just tears and like, you know, like gunk you get in your eyes when you like go to sleep and stuff, like it would just weep like tears and like that sleepy stuff. But then my eyes developed dry eyes, so I don't really have a lot of tears in my, I don't really have a lot of water in my eyes, so I kind of counterbalanced the blocked tear duct by just not producing tears. So I hacked the system, but also just gave me more problems because my eyes are a nightmare and they're so dry, and I have to use the eye drops at least twice a day, and sometimes up to like 4 or 5 times a day. I also have very weak eye muscles, which is why I wear glasses. I can't see near or far because my muscles just don't focus, so I have glasses that help them to actually do what they're supposed to do and focus on things. I also onto hearing. I have mixed hearing loss. I have high and low hearing loss, specifically in my right ear, which means I can't hear consonants. I can only hear vowels, so it means that whenever someone speaks to me, it sounds very mumbled and quiet and very hard to pick out what someone's saying, so I have to have subtitles. I rely on lip reading a lot, so I have to be looking at someone when they're speaking to me so that I can get what they're saying. I really struggle with accents because that makes it even harder for my ears to try and make it clear what someone is saying to me. And yeah, overall I just can't hear that. I can hear like the volume of things. It's not like everything is quiet, it's just that nothing anyone says is clear. I just can't understand what people are saying, so yeah, quite annoying. And I have a hearing aid in my right ear. And then on to finally general issues. I have extreme chronic fatigue, which doesn't mean I'm just like a bit tired. It means I never feel not tired ever. I've never felt in the last 9 years not tired. Yeah, so chronic fatigue doesn't mean I'm just like a bit tired. It means like I just sometimes just can't move because I'm so exhausted. Like I've sat here and talked for half an hour. I won't be able to talk for like a good few hours because my brain is just so tired and I'm just so exhausted. So when I see people and speak to people, that really drains me. Doing any kind of brain work is exhausting, moving my body is exhausting, and yeah, it's really severe fatigue. I also suffer severely from chronic pain pretty much everywhere in my body, specifically in my back, shoulders, neck, knees, hips, head. It's like head, shoulders, knees and toes basically, but that's extremely debilitating chronic pain, and most days it means I can't really get out of bed because my pain is so severe. I use an electric wheelchair to get around and I can walk a couple of steps, but not unaided. I have to have someone with me to walk because I just can't move my legs that well thanks to my spinal issues. I have anxiety quite severely. I suffer from depression from time to time, depending on my situation. But yeah, I have anxiety and a lot of trauma from my medical life for the last 9 years. I also have insomnia, so my sleep is very broken up. I have extreme nightmares and I wake up a lot from pain, that kind of stuff. I have low ferritin levels, which is like, I think it's like your iron stores, or is it something to do with iron? So that also adds to fatigue. So yes, that is all the things that are wrong with me. You may be thinking, that's quite a few things, Lizzie, and you would be correct. I also am currently suffering from a functional movement disorder. I had surgery in August and September, and the trauma to my body set off a functional movement disorder, which basically your brain just kind of malfunctions and decides that your one part of your body or multiple parts of your body should do movements that are involuntary, and for me constant. I will put up some videos of what my left leg is currently like, and it's very difficult to manage because I suffer from dislocations anyway, and when my leg is doing this, it means my joints are just moving out of their joints all the time. That's very difficult to deal with. I'm waiting for a referral to St George's because they have a great neurological department, and hopefully they will be able to treat this and help like retrain my brain basically, because it is very debilitating at the moment and I'm basically bedbound. This is basically all I sit up for, so yeah, it's a very severe functional movement disorder. Usually they're more mild than this, but mine is a very severe case and again very debilitating. So I hope this video was helpful in any way and maybe shed some light on some different conditions that people suffer with that aren't necessarily like your standard cancer or whatever. I think, you know, there's like some things that people know about, but a lot of conditions are just very underrepresented and just aren't talked about, and I hope that this was a helpful video, an informational video, and that maybe you learnt something or you were able to send this to a family member to help explain your symptoms, or yeah, I just hope this was interesting. This is basically why my body can't function. So yeah, I hope you enjoyed this video. I don't know, I hope you found this video in any way interesting, and yeah, thank you so much for watching. I hope you have a wonderful day and I hope you learned something new today. So thank you for watching. Sorry this is kind of a different video, but I really wanted to make something about my conditions and just to help inform people on, you know, what actually happens in my body, which is a lot of really awful stuff. My next video will be back to our regularly scheduled book videos, but yes, thank you so much for watching. I hope you have an absolutely wonderful day, and if you're chronically ill, I hope you have a good a day as you possibly can. I do have a giveaway currently running. It's on my Spooky Reads video. I will leave a link in the cards. Basically all you have to do is subscribe and comment your Twitter or Instagram handle on that video, and you can also retweet my pinned tweet on Twitter and follow me on Twitter for an extra entry. That ends on the 24th of October. So yeah, if you want to enter that, go ahead. So thank you so much for watching and I will see you next time. Bye!